Health officials announced a new measles exposure in Montgomery County, the latest alarm in what's becoming a fast-moving situation. And just this week, Northern Virginia confirmed a new measles case on the heels of reports at multiple exposure sites in Manassas, Alexandria, and Gainesville. With rising cases and growing concern from parents and pediatricians, we're joined right now by Dr. Alexandra Yonts from Children's National to break down what families need to know. Dr. Yonts, thanks so much for joining us. With these latest cases, the new ones, how significant of an outbreak risk are we looking at right now in the DMV?
So thankfully, we in the DMV, especially in Montgomery County, Northern Virginia, and DC, do have relatively high rates of measles vaccination coverage or MMR coverage, which we think optimistically has been sort of preventing this from turning into a bigger outbreak, since we have seen quite a few sort of sporadic cases, mostly coming from travelers over the past several months.
Now, given how contagious measles are or is, remaining in the air for up to 2 hours even, what symptoms should parents be watching out for, and how quickly should they seek medical care if they think that they've been exposed? And I know it takes a while before the symptoms actually show up.
Yeah, the incubation period from time of exposure to symptom onset can be as short as 7 days, but is usually closer to 2 weeks, sometimes as long as 3 weeks. So really kind of a wide range. But fever is almost always the first symptom to present. So if you or your child develops a fever and then particularly goes on to develop sort of red, watery, painful eyes, a cough, and congestion in that pattern, that is all things that we should, look out for, and would encourage pediatricians or families to kind of stay home and not potentially be around other kids. But the rash is really the trigger for getting evaluated for measles, which is classically red, blotchy, starts on the head and face, spreads its way down the body. And that, starts about 4 days usually after the fever, and is very classic for measles.
Now, there's a lot of concern about the vaccination gaps. What's your message tonight to families who may be unsure of their child's MMR status or how critical the vaccination is in preventing this from getting worse?
So the vaccination, MMR vaccination, is absolutely critical. It's a phenomenal vaccine. It has excellent protection, 95% protection, at one dose, 97% or higher after 2 doses. So really critical to keeping this disease that's very contagious in check. So best thing to do is to check with your doctor or your child's doctor to see if they've had the appropriate doses, usually one at around 1 year of age and a second dose between 4 to 6 years of age as kids are approaching school. There are some groups in the population that might be less likely to have been immunized, particularly those that were sort of adolescents or young adults in the late 1980s, early 1990s, possibly only received 1 dose, so may want to talk to their doctor about getting that second dose to boost their immunity. Similarly, infants 6 to 12 months of age, if they will be traveling internationally, which we consider a risk for measles exposure, could get that first dose early for that extra protection in that critical period of time.
Dr. Alexandra Yonts with Children's National Hospital, thanks so much for your insight and joining us tonight.
Thank you for having me.
All right.